Hello and welcome back to Casual Conversations. This is a video series presented by the Association of Cannabinoid Specialists that features panel discussions with clinicians and scientists on various topics related to the use of cannabis as medicine. My name is Christine Goedhart and I'm the Education Department Chair at ACS. I'll be the moderator for this episode's conversation, and I'm joined by our panel of cannabinoid clinicians, Dr. Jordan Tishler and Dr. Adam Abodeely. So today's topic is cannabis and athletics. And the first question I have for both of you is, what are some common reasons why athletes might use cannabis? In other words, what's the connection between cannabis and athletics? So Adam, how about let's start with you?
Great. Well, welcome everyone. And no, listen, I really love this topic because this topic truly changed my bias of, the lazy, overweight stoner or the medical cannabis patient. I started working with patients with medical cannabis around 2011, 2012, and New York State legalized medical cannabis in 2013 for medicinal purposes. And it was shortly thereafter that I started consulting with athletes who were interested in using cannabis. And prior to that, my experience with cannabis was largely terminally ill cancer patients, people with refractory inflammatory bowel disease. So I never really gained an appreciation um, for cannabis outside of the realm of those treatment of those conditions. So, why over the other reason that I'm very interested in this topic is because my practice is in upstate New York happens to be home to an area where there are a lot of aspiring athletes, a lot of aspiring Olympians. In our town, there's an Olympic committee training center, so there's athletes from around the world there all the time. And I've consulted with several of them on this issue. And so, you look at, well, why would an athlete be interested in using cannabis? Well, several reasons. The first is they may just have a medical condition like any of our normal medical cannabis patients might have that meets the criteria, and they might be interested in knowing how it might interact with other medications they're on, how it might affect their physical performance, what might be the legal implications of them using cannabis. So, I've helped patients navigate through that, but those are specific athletes who have a medical condition that they know cannabis can be used for. So that's, but that still kind of falls within the realm much more of, medical cannabis. But nonetheless, there are athletes who have these same medical conditions that we're accustomed to utilizing cannabis for. The one of the biggest reasons, particularly with endurance athletes, cross-country ski racers, triathletes, marathoners, ultra marathoners, a lot of the reason that they enjoy using is for the psychological and I'll call them cognitive effects, if you will. If you speak with athletes, or if you're an athlete yourself, particularly with endurance athletes, there's a physical component to the sport, but there's also a mental component to it as well, a form of mental resilience that a lot of athletes have to maintain. And when you talk to some of these athletes who report to me using cannabis throughout their training and through their competition, they'll make comments like, well, it helps them stay focused. It helps them avoid boredom. It affects their it alters their perception of pain and fatigue. Why that might be. Well, we could talk about those reasons forever. But also we know there's a centrally acting analgesic effect of cannabis. So, they talk about, they use it because it helps them get through the event. And which of course, begs the question of, what's considered a performance enhancing drug and what's not. Another topic here, but athletes will say it alters their perception of time. When they're out there for 4 to 6 hours in some cases, they believe that the time feels a little bit less than that. And so there is a component of a psychological component that is very hard to describe fully, but athletes report that, it helps them from a mental resilience standpoint. A lot of people just say that it makes them, feel better, during their exercise. We know that we as humans are designed in a positive fashion to want to exercise, and that we now know is largely through our endocannabinoid system. It's a positive reinforcing behavior. When we exercise, our endocannabinoid levels, our natural anandamide levels, for example, which is the bliss molecule, is elevated in when you exercise. And so if you naturally have that occurring and you stack on THC, well, now you've got, more of that bliss molecule, if you will, in your bloodstream. And I think that may be one reason why some athletes also claim that, they feel even better with a little cannabis on board. With the psychological component, there's also, the potential for anxiety reduction. There's several people claim that it helps calm their nerves, although we know that for some people it can actually be anxiety provoking. So, there is this kind of, I think to start, there's this, we'll call it largely like a psychological or a cognitive effect that athletes experience when they're using cannabis, or some of the benefits that they claim, why they might be using it. The other reason athletes will use it is for insomnia. No different necessarily from a medical cannabis patient suffering from insomnia than an athlete suffering from insomnia, with the exception of maybe some of the insomnia is more related to anxiety, pre-race jitters, these types of things, more so than somebody with another form of clinically diagnosed insomnia. Another reason athletes will consider using cannabis is for pain management or as an anti-inflammatory. And of course, there's acute injuries and then there's chronic injuries, which athletes can experience. Something like tendonitis or arthritis may be more of a chronic condition, which they may find. The other reason I've seen more and more athletes openly admitting to using cannabis is as an alternative to alcohol as well. And that's clearly as we'll call that more as as a recreational side of things than anything else. But a lot of athletes will say, well, I'd rather consume a few milligrams of THC rather than have a three to six beers with my friends, because I got to train tomorrow and they don't want to deal with the hangover that's associated with it. So, to start, I kind of threw out a laundry list there of, of really just purely subjectively of why I see of who I see coming in and why athletes want to use cannabis, is for those variety of reasons I mentioned.
Great. Thank you for sharing all of that, Adam. Jordan, anything to add?
Well, I think that Adam just did a really very comprehensive job. So rather than sort of adding, I might, just respond to a couple of points. The first is the question about performance enhancing drug. And I think that, the case can be made, as you described, Adam, that, there is a psychological advantage to using it in terms of endurance and resilience and that sort of thing. But at least as we have so far described and defined performance enhancing, those are generally viewed as measurable effects. Things like VO max on testing, max muscle strength, speed, those sorts of things. And there have been a number of studies now in athletes that have shown pretty consistently that cannabis is not a performance enhancing drug. And in fact, it's a performance degrading drug, not necessarily by a huge margin, but the point being that those studies tell us two things. One is that, if you're gonna go and compete in the Olympics, you probably don't want to do that while you're intoxicated at that time. Doesn't mean you wouldn't use it in the training, but it means when it comes down to whether you're going to get the medal or not, then you might want to not do that. But the corollary to that, the second thing, is that this is why we've seen major sport controlling organizations like the NFL and the NBA and such kind of backing away from their prohibitions against cannabis use is that, if they look at this and say, well, you're not going to be in an enhanced state. We may be unhappy with you if you're not in your peak state, but at least you're not getting in trouble with sort of these governing bodies. And so that's been very helpful. I think the other thing I would touch on is that Adam mentioned, using it acutely while you're training. And he touched on also in the post-training convalescent period. And I've certainly seen lots of athletes who've asked me about cannabis as sort of the day after, instead of taking ibuprofen or something like that, they might use cannabis, or frankly, all of the above. And I think that that's perfectly fine. I do think that cannabis is a fairly good pain reliever. The evidence for its being an anti-inflammatory in intact human beings is kind of poor at this point. So I wouldn't hang my hat on that. And certainly that, gives the nod back to the ibuprofen, not that you can't take both together. And then something that we had touched on even before we kind of started rolling the tape today was that we also have to acknowledge that athletes come in sort of all different shapes and sizes, and in particular ages, and that cannabis is not legal for minors. And it's also thought not to be very good for their neurobiological development. So, in our discussion of how cannabis can be helpful to athletes, we need to kind of not give our younger listeners, if there are any, the idea that they should be doing this. And I think that there's certainly a neurobiological maturation issue to be described. But I think the largest thing is that if you're a varsity athlete and you get caught with this stuff, that's the end of your career. And frankly, that would be a shame. So that's kind of my perspective on it. And so I think that anybody who's younger, who's listening to this episode, really needs to kind of think a little bit about what those risks are. And it's unfortunate, I think, that in our society at the moment, those risks are real, but they are real. And we don't want anybody losing their starting slot next year, for example, because they get busted with a joint.
Thank you for bringing up that consideration of age, Jordan. And I know that there might be some additional special considerations involved with having conversations about cannabis with athletes in a clinical context. So I'm curious, if you've had any patients who are athletes, how do you navigate conversations about cannabis with them? Is this different than any conversations that you have with other patients? Also, in the case of organized sports, we know that policies around cannabis can vary from sport to sport. They can shift over time. So how do you think that clinicians should approach the tension between medical guidance and athletic regulation in these conversations? Jordan, how about let's start with you this time?
Starting with me?
Yeah.
To me, the discussion's really not that different. I need to understand what it is that athlete is interested in and why. And if their expectations or desires are sort of in line with what we think it can do, then that's great. If they have gotten it wrong somehow, then it's my job to kind of tell them, this is what we know, this is what we don't know, kind of thing. And then get into the specifics of, what is this going to do for you? What is it going to, how is it going to interact with your sport? How does this play with your organization, controlling body, that sort of thing? I think those are important. Again, most of the people I've dealt with have been endurance athletes. I think that, when you're running marathons, this seems to be something that comes up quite a lot. And generally speaking, I think it's a very helpful adjunct, but not necessarily on race day.
Great.
Yep.
What do you think, Adam?
I agree with that. And one of the first questions that I ask, athletes too, is, are you interested in the THC option, THC route or not? And if so, then, what are you going to be tested? The reality is the majority of athletes, even majority of endurance athletes, unless you are top level and you're being scrutinized by, the an organization like the World Anti-Doping Association, WADA, which is the main, kind of the main governing body, most people aren't tested. A lot of what we'd consider, as athletes are, you know, people who are personally competitive, so to speak. People who run not every person who runs the Boston Marathon gets tested, right? It's, the top few will get tested, top professionals, but there are people that, personally say, hey, I can run a 9-minute marathon without cannabis, but when I trained with cannabis, maybe I did 8 minutes and 50 seconds. So maybe a personal thing for them. So trying to understand, also, are they going to be tested or not? And I think, the testing, I think, is at least something that's worth at least a brief discussion here. When because there are athletes who will want to train with THC, but may for testing purposes have to be entirely free of the THC metabolites. And so I think timing around this is worth a discussion. What we know right now is that the World Anti-Doping Association, how they test for is they test for the carboxylated THC metabolites, which occur from naturally occurring THC or the synthetic THC analogs. And it's done through I believe it's urine. Maybe it's confirmed with blood if there's other concerns. But for the large part, they'll test through urine samples, and they're looking at how much of these metabolites are in the urine. And in 2013, they loosened. It used to be, I think it was like 15 nanograms per milliliter that would cause a positive test, but in 2013 they increased it to 150 nanograms per milliliter. So it's not a zero tolerance policy, but what they're trying to determine with testing is, were you experiencing potentially any of the clinic or physiologically significant effects of THC during the competition? And they don't have a direct way of doing it other than measuring the concentration of metabolites. And what they've determined was that within a couple of days, they could test you within 2 days, I think, is for most really high level training. And that if you test above 150 nanograms per milliliter, then they're going to assume that you had enough THC in your bloodstream during that event to be considered to have it be seen as a positive test. So of course, there's athletes that want to know how long should you abstain from cannabis if they're going to if they want to use it for maybe training purposes, but don't want to take a chance of getting testing positive. And that's not a straightforward answer. What we know is that if somebody is completely cannabis naive, and they consumed a small amount of cannabis, that within a few days they might have a negative test. If somebody is a more regular consumer, it could take 3 to 4 weeks in some cases. So the I, and that is determined by amount of cannabis consumption, frequency of cannabis consumption, and how it's stored in individuals' bodies. If they have more fat, they might be prone to storing more cannabinoids, and their just general metabolic rate. Now, fortunately, most athletes, particularly endurance athletes, don't have a lot of fat, and they have pretty high metabolisms. And I do think that they tend to chew it up a little bit quicker than other people, but I wouldn't want to be responsible for telling them that, you've got a week and you'll be okay, when they might still test positive for up to 3 to 4 weeks. So generally speaking, in people that are high level and really are going to be scrutinized, I tell them to abstain for at least 3 to 4 weeks prior to THC. And if they're using and if they want to continue to use like a CBD product, a supplement, which some of them will want to continue to do, then we just have to make sure that they're getting it from a qualified source that's tested to make sure it's not contaminated with any sort of THC.
I will say that in my patient population, who obviously are using cannabis on a regular basis, by and large, I have seen people test positive for out as far as 3 months, even though the common lore is, 1 month. And what I tell people is, you can go on Amazon And for about $5 a piece, you can buy urine tests that are chemically identical to what would be tested in the official setting. And so what I would advise people to do is, stop using cannabis and once a week use a test until they test negative, and you kind of backtrack from there. Um, I think that's a fairly reasonable way. I've used that more in the setting of people being concerned about being tested for job applications than for athletic events. But I think nonetheless, the theory still holds. It is interesting and maybe makes it a little bit less relevant that those tests turn positive. They're basically they don't give you a number, right? They just say positive or negative, kind of like a pregnancy test. And they turn positive at a very low rate, which is 5 nanograms per deciliter. So that's considerably below the level that Adam was just saying WADA is looking for. So it may be actually too stringent for this application, but if it's negative, then you'll certainly be okay on the official test.
Finally, I'm curious what gaps in evidence or clinical guidance might make it difficult for you to advise athletes, and what kind of research would you like to see moving forward in this domain? Also, looking ahead, what changes, whether in clinical practice, education, or sport policy, would you like to see to better support athletes who use cannabis?
Happy to start with that. I think, there's a lot of unknowns still about cannabis, and it's really not much different than it is as cannabis as it relates, to athletes. What I would really like to see is us to better be able to define how athletes might be able to use it in a legal in a legal environment. And in order to do that, this whole definition of whether or not cannabis is truly a performance enhancing drug or not, it needs a little more clarity. In order for any sort of substance by WADA to be banned, it needs to meet two of three criteria. It either needs to be a performance enhancing substance, which, as Jordan alluded to, most of the measurable or ergogenic variables that are measured have not shown any significant improvement. Maybe a couple have here or there, but for the large part, if anything, they've showed maybe a decrease in measurable performance. So what we're talking about as a performance enhancement right now is from a psychological and maybe a pain management and things like that. It's going to be very hard, to really nail that down because they are much more subjective performance enhancing measures. So I think that I would love to see some, more data on that and purely on the ergogenic side of things. The other thing we mentioned, two of these three criteria being met for a banned substance. The second is it a health risk? Well, we know cannabis is not completely risk-free, but when it comes to athletes, there's other considerations, any sort of acute coronary events. Are there, if you're a cyclist or a swimmer, there may be some coordination things to consider. You don't want people falling off their bikes at high speed because they were intoxicated from THC. So I think we need to define that a little bit better. The third thing is this violation of, what do they call it, in the spirit of the sport, which is something that that's why there's only two of three criteria that need to be met, because the third one, I think, is going to be just always a gimme for debatable, I guess. But I would really like to see some better data on the performance enhancing effects and any sort of potential health risks, to athletes, for us to be able to make some, guidance moving forward. But of the reasons that we mentioned, that we brought up in the beginning of why athletes might use cannabis, I think they're all legitimate reasons. But it would certainly be nice if we didn't have to always consider how to work around a system of drug testing and things of that nature. Because as Jordan said earlier, right now it's not advisable for people who are still developing neurobiologically to use cannabis, particularly if there are alternatives to it. So defining the safety and defining the performance enhancing effects are high on my list of what I think we need to gain some more information on in order to move forward and make further recommendations to athletes.
Cool. I assume you want me to answer that question.
Yeah,
So,
anything else that you would add?
I would like to see, and this isn't specifically about athletes, I mean, because it's certainly germane to many of our patients too, is, that anti-inflammatory claim, which bears out wonderfully when you look at it in cell culture. The question is, what does it do in a human being, right? I mean, we know that certain cannabinoids, all of the cannabinoids in cell culture look anti-inflammatory. We also know that, for example, when we've studied CBD in Crohn's patients, it hasn't seemed to work, whereas THCA has seemed to work. But, that really needs to be nailed down. And I think that that would be helpful in that sort of post-workout convalescent period for athletes, as well as for, our older patients who have Crohn's or rheumatoid arthritis. So I think there's a lot that's been said there and not a lot of research. So that would be a huge area, I think, for us to get to shortly.
Before we close, I'm wondering if there's any final thoughts that you'd like to share.
No final thoughts on my end. Just the fact that I think when it comes to cannabis and athletes, we need to keep an open mind, but continue to, to let our decisions and our guidance and our consultations with these athletes be, evidence-based driven and keeping, them safe and protecting them from any legal ramifications.
Yep. And I would, just also say that like we do with our patients, we should be advising our athletes on how to do this safely. And so, obviously we talked about physical accidents. We've talked about the risk, from professional organizations, but also we probably need to mention that it is a potentially habit forming drug and that, small amounts are probably helpful and larger amounts are probably more risky. And, just kind of help the athletes frame this in terms of what's healthful for them.
All right. Well, thank you both for sharing your insights on cannabis and athletics with us today. And for those of you watching, I want to thank you for taking the time to listen to this conversation. If you're interested in learning more about cannabinoid medicine, please check out the education section of the ACS website, which includes videos, blogs, and courses on a variety of relevant topics. And you can find all this at cannaspecialist.org. And if you aren't already, please consider becoming a member and joining us in the effort to advance evidence-based cannabinoid care and to shape the future of medical cannabis through education, research, and advocacy. Thanks again, and I'm looking forward to seeing you next time.